Good afternoon, everyone, and welcome to the Our Doctors versus the Internet Facebook live chat. And today we're having another conversation about COVID-19, but today's topics will be caring for patients with COVID-19 at home and also at-risk populations like minorities, nursing homes, the homeless, and things like that. So I'm Prescott Stokes III. I'm the Integrated Content and Marketing Manager here at the TCU and UNT HSC School of Medicine. And today I am joined with Dr. David Capper.
Hi there, and welcome to the chat.
Thank you, Dr. Capper. Now, Dr. Capper is actually an internist and a medical director at John Peter Smith Health Network in Fort Worth. And I am also joined by Dr. Amy Anderson.
Hi, everyone. Thanks for being here.
Thanks, Dr. Anderson. Now, Dr. Anderson is actually the founder of the Global Nurse Consultants Alliance and also a graduate health policy fellow with the Heritage Foundation. Now, Dr. Capper is the Department of Clinical Sciences chair at the School of Medicine, and Dr. Anderson is an assistant professor at the School of Medicine. Now, you can join into this conversation and chat with us. All you have to do is get into the comment stream on Facebook, leave your question, and then we will get you some answers. But before we get to the questions from our viewers, I'm going to start with you, Dr. Anderson. So for people who might be tasked with caring for a spouse, for their child, an older relative, a friend, and they're quarantined together and that person has COVID-19, if the symptoms are not severe, what should the primary caregiver be concerned about as they watch over them?
Sure. First, they should be watching for any changes in their symptoms to ensure that they're in a safe and mild symptoms are, your normal sort of cold-like symptoms. But if it moves into things like difficulty breathing or pressure in their chest or a high fever that won't respond to over-the-counter medications, that's when they want to call their health care provider again. And I'm sure Dr. Capper will speak more about that a little bit later. But the other thing that they really need to do is to isolate that individual in their home away from other family and friends to ensure that we're not spreading it throughout the house. We know the contact is really how it's spread. And so the more time that they spend with individuals within the household, the more likely the other individuals in the household will get sick. So if they can have their own bedroom, ideally, their own bathroom, and they stay away from individuals in the house, and you really look at having one caregiver going in and out of that room, increased washing of hands, and all of those hygienic practices to ensure that the rest of the family and friends are safe.
So I heard you say increase washing of hands. We all know wash your hands for 20 seconds, mild soap, some warm water, don't touch your face. But as far as for the caregivers, how often should they be cleaning? And when I'm thinking about cleaning, if the person is in a room, the bed will need to be clean, the sheets will need to be clean, bathroom areas, etc. How often should the caregiver consider doing that?
Using your disinfectant based upon manufacturing guidelines, ensuring that you're continuously trying to keep those areas clean will help prevent the spread within the rest of the household. As for the quarantined individual in the room, and hopefully their own bathroom if that's possible, really don't disturb things, every couple of hours, but every few days you'll want to go and wipe things down. And if you're that caregiver, you don't want to stay in that room for very long, so you need to do it very quickly. You don't want to be sharing bedding or sharing towels with individuals that are sick. Laundry can be done. I would do a separate load for sure for the individual that's sick on the hottest setting, but make sure that you're not, sharing towels and contact, kissing, all those things need to end. You need to try to stay about 6 feet away from the individual and wear a mask when you're entering the room if you can.
Okay, good information. Thank you, Dr. Anderson. And just since we're on the topic of being a caregiver, Dr. Capper, I kind of want you to jump in just for a second. Can you talk about nursing home patients? When you think about nursing homes, there's always caregivers inside of nursing homes. And we've heard so many stories about nursing homes in our general Dallas-Fort Worth area, where we're seeing a lot of spike in deaths And also, even across the country, we're seeing a spike in deaths in nursing homes. So can you talk to us a little bit about how nursing home patients are becoming infected with COVID-19? And also, how can we prevent that from happening so it doesn't continue?
Well, then I'll echo what Dr. Anderson said. A lot of this has to do with time spent with somebody who is shedding the virus. So there's a direct proportional relationship to somebody contracting the virus to the amount of time they spend with somebody who is shedding the virus. So in the nursing homes, you have a concentration of people who are at risk because of age and comorbid conditions to begin with. And then if one person, a caregiver typically, comes into that setting and spends a lot of time, which is necessary in nursing home care because so many people require hands-on care for lengthy periods of time, then that virus being shed will have much greater opportunity to infect the person that they're contracted with. So in a nursing home, you have a high concentration of people at risk in one location, and you have a cadre of caregivers that are going from patient to patient. And many of these are also going from nursing home to nursing home.
So when you think about nursing homes, and now I'm also just thinking about people who are the age of 55 and older. So according to the CDC, at the beginning of this week, at least 7,500 people that were 55 or older had already succumbed to COVID-19 related symptoms. I know there's more people of that age inside of nursing homes, but can you kind of explain to us why this virus is affecting older Americans at such an alarming rate?
No, I wish I could. We all wish we could. The epidemiology and the understanding of the actual biological effects of the virus are still tremendously unknown in terms of why these populations at risk actually are getting the worst outcome, which is death. We really don't understand that, but it is a fact of observation. For example, the fact that no children have died in the United States, and very, very few children have died worldwide from this, and those children that have died were those who had some kind of pre-existing condition or some kind of immunological disorder. So we really don't know, we just know that it's true. And so people that have multiple birthdays under their belt, people who are obese, people who have cardiovascular diseases and particularly respiratory diseases, and then lastly, people who have any form of immunocompromise, including people with diabetes, because it can affect their immune responses. Those are the people who are particularly at risk to develop the worst outcomes from this COVID-19.
So, Dr. Capper, we just got a question from one of our viewers, and I want to thank everybody for joining us for the chat. And you can always just leave your question as we're talking, and I will definitely get to your question and get you some answers. So our first question is from Kelly. So, Dr. Capper, her question is, how has COVID-19 directly affected hospice care?
Oh my goodness. Well, the first thing it did in our area was because of the lack of a deep resource of warehousing of PPE or personal protective equipment. Many of the hospices in the area ran out quickly relative to the protection of their own staff to care for people for hospice with COVID-19. And this was a real concern for many, many local hospices. We are seeing a buildup of those resources right now, but that was the first concern. The second concern was, how could they effectively provide hands-on care? Because that is the heart and soul of hospice care, is providing hands-on care for people who are actively sick and or dying with the virus. And so it was a logistical issue as much as it has been for anything else. You have great people who are tremendously dedicated to the care of folks. And so they weren't going to necessarily be daunted by the fact that this had the potential to be a deadly virus to themselves, but it certainly required an element of planning, logistics, and obtaining of the proper equipment for their own protection.
Right. So we're going to pivot just a little bit because we had a question that came in from a viewer for Dr. Anderson. And so, Dr. Anderson, this question has to do with mask and gloves. So the person wants to know, if you're caring for a loved one with COVID-19, should you be wearing masks and gloves? And I'm thinking, should you be wearing them constantly?
In direct contact with the individual, then yes, if you're entering that room, you should have a mask and gloves on. And if you're not able to wear a mask, then the individual that's sick should put it on. And so that there's not that potential transmission through those contact and droplets in the air. If the individual cannot be isolated and they're coming out of that room, they should be wearing, the sick one should be wearing the gloves and the mask. But anytime, yes, that you're coming into contact with that patient, your family member or your friend that's a patient, you should do your best to wear a mask and gloves to prevent transmission to you. Now, remember that your gloves are just going to be just like your hands after you've touched things. So you're going to have to remove the gloves when you exit the room and wash your hands thoroughly. Anytime that the individual has touched, make sure that you're washing your hands afterwards and do it thoroughly with that 20 seconds or more.
And Dr. Anderson, we got the majority of your answer, really good. Just want to apologize just for some technical issues with sound going in and out. So I appreciate you guys sticking with us. We did have another question that came in while you were answering, Dr. Anderson. And this question actually is probably more along the lines of Dr. Capper. So what a lot of people want to know is about the homeless population. Dr. Capper, I know you work with the homeless population here in Tarrant County a lot. And what is it like helping the homeless at this time? And then also, can you just explain to people a little bit about what you do as far as providing street medicine for the homeless population here in Tarrant County?
Well, I've been involved with street medicine since I was a resident, working at a homeless clinic and street person clinic in Portland, Oregon back in 1980. And coming to Fort Worth, have been involved directly with CARE. We founded a clinic in 1989 and have been continuously serving people since then at a homeless clinic. And so a lot of these folks are my friends. And what's it like? What's it like to see people who you work with every day and have a heart for, that are really particularly at risk if the virus gets into that community. So our first efforts were to try and implement the same mitigation proposals that have been implemented everywhere else for people who generally aren't quite as, I don't want to say not as interested, but generally not as attuned to the idea. And then the other thing is the idea of self-quarantine in home for those who are at risk. That's an interesting concept when people don't have a home. So you're constantly trying to come up with ideas to help try and facilitate improved conditions for the people. So then you divide those into those who are sheltered and those who are unsheltered. And the city's done a fantastic job, and so have all the shelters in Fort Worth, done a fantastic job of trying to create space between the bunks, for example, creating space in the waiting lines, creating space when people are getting food. And so we've done seen a tremendous effort played out to create those spaces. The other thing is the city of Fort Worth opened up the convention center for people who were unsheltered to have shelter, and included in that is a quarantine area. Also included with that is a medical oversight for that. So we have volunteer doctors and nurses, and we have JPS staff who are going there, including the residents, to care for the people who are now at the convention center. So these are things that have happened. And then just yesterday, I was at clinic and I saw a big basket of homemade masks that were being handed out to the people coming in line for their food. And these were all handmade by people out in the community and donated to this particular ministry to provide for the homeless people. So those are things that are happening. And we really appreciate that.
So, Dr. Capper, we had another question, and this is related to the homeless as well. Since we all are doing shelter in place right now, is there anything that we still can do to help the homeless?
Oh, yes. First of all, one of the first questions that came out was, how do we protect the homeless best? And one of those ways is by a lot of people who usually will go down and find people who are homeless and provide provisions and give things out to them, is to actually limit direct contact with homeless persons. And instead of directly giving of items, is to provide items to the shelters and to other ministries that work with the homeless. That's one of the first and most important steps, is to limit exposures. And then secondly is call the shelters and call the different ministries that work with the homeless and ask them directly, what do they need? Because this week's need may be different than next week's needs. So those are some of the best ways. And then lastly, continue to pray for our community and pray for them.
Right. And it's interesting, just the church being such a big facilitator between the public and helping the homeless, like in a time like this, is so important. We did have another question that came in, Dr. Capper, and this is more of a science-related question, so maybe you can share your thoughts with us. So the question is, should we, the general public, be tested for antibodies to see if we already have had COVID-19? And also, if you get COVID-19 and we do develop antibodies and some sort of immunity, will that protect us from getting it again?
Great question. So again, the biology of viruses is a very fascinating study, and not all viruses act alike. For example, hepatitis B, which we're all familiar with, some people are conferred lifetime immunity from exposure to hepatitis B vaccines. Some people don't get lifetime immunity, but get multiple years of immunity. So the reason we get booster shots for vaccines is because that immunity starts to wear off. We don't know enough about COVID-19 to be able to answer the question. We do know that there is a short-term immunity. We don't know how long, we don't know how effective, but we do know there's a short-term immunity, and that's what is testing for the antibodies in people's serum. Should people get tested? Well, in the ideal world, it would be great. There aren't enough tests to do that for 335 million Americans. And so how do we go about a judicious and practical way of testing for the antibodies and for that immunity? A lot will play out over the next month as more and more tests come to bear, depending on the price, depending on the efficacy, how many false negatives and false positives are there. These are things that will have to come out as this whole technology comes to fore over the next few weeks.
Right. And I guess for the general public, we have to give physicians time, right, to like actually figure this out and give us solid answers, so that way we can progress forward and get back to some sort of normalcy, right?
Absolutely.
Dr. Anderson, we have a question that came in for you that's related to home care. So the question is, are there certain medicines that we should be keeping on hand in case someone inside your home develops COVID-19 symptoms, whether they're severe or mild?
Yes, absolutely. Any kind of fever-reducing medication you should have on hand, as well as cough medicine, and anything that can control symptoms, like cold-like symptoms. We don't have a treatment per se yet. Hopefully we'll have a therapeutic at some point. But for now, everything is symptom control. So with mild illness, you're just trying to control the symptoms that you have, make yourself more comfortable, as well as try to reduce the fever if that's possible. And there are a lot of pharmacies that are delivering. If for some reason you run out or you don't have it on hand, just get the pharmacy to deliver. You should, if you have COVID in your home, you should be staying at home and not going out into the public to prevent spreading it around the community.
Now, Dr. Anderson, I also had another interesting question. We love our pets. Right? A lot of people have pets inside their home. So should the caregiver be mindful of having pets roaming around the home while the infected person is quarantined?
So I would keep the pet out of the room with the individual that's not feeling well. Just, we don't have any evidence to say that that pets are either getting this or spreading this virus at all. But I would just be mindful of keeping that pet out of the room of the individual that's quarantined in your house. And then again, wiping those surfaces down every couple of hours. I mean, there are different strains of the coronavirus that pets are susceptible to, but at this point, we don't have any evidence of that with COVID-19.
So, Dr. Capper, we have another question that came in, and I want to thank everybody for submitting questions and being a part of this conversation. And this probably goes back again to the science. The question is, when someone has coronavirus or COVID-19, they seem sick, then get better. Then they get sick again. Why does that happen?
Well, I would answer that by looking at the degree of illness. For somebody who is moderately ill to the point where hospitalization is of consideration, what we've observed is two things happen in those people. We, meaning those people who've been on the front lines for this now for the last 3 months. There is a phenomenon where the lungs get particularly involved with a unique type of interstitial process that all of a sudden just goes fast, and the ability to put oxygen into the blood is severely impaired. And that progress, or digress more accurately, can happen very quickly. And so for people who are really ill and then having a hard time breathing, this is one thing that can occur. The other thing we've observed is this thing where you get a cytokine storm. Cytokines are chemicals that are released by white blood cells in the body to help fight off infections. Well, some people get overwhelmed by their cytokine response in this illness, and that in and of itself causes an acute, severe degradation of their status. Now, for people who aren't that sick and say who, for example, are at home, they have the virus, they're at home, they're getting over it, you have this waxing and waning effect because you have this interplay. It's a fight between the virus and the virus replicating and making more viruses and trying to take over more cells, and the body trying to fight it off. And you have this interplay going on. It's kind of like any boxing match. It's a back and forth sort of thing, and the body is engaged in this back and forth. And we've all experienced that to some degree with some flu viruses that we've had ourselves.
Right. That's a really, really clear analogy as far as like the fight that's happening internally. Dr. Capper, we have one more question that came from Paul on Facebook. Thank you for your question, Paul. So the question is, should COVID-19 patients at home spend more time on their stomachs? I know this question kind of sounds a little more on the sciencey side. I know people try to find home remedies for a lot of these things. Is that something that helps in some sort of way, since it is an upper respiratory disease, virus?
Well, it's pretty astute, because we've seen that for patients in the hospital who are on ventilators, more than half of them do better if they're ventilated while they are laying prone as opposed to supine, on their stomachs instead of on their backs, which is an interesting phenomenon. And there's some dynamics, the physics of the perfusion of the lung has a lot to do with that. So the question is, could that same observation be applicable for people at home? I would say it's worth trying. Now, if people are really that sick in terms of breathing, then that's a different story. They may need to be in the hospital, because the hallmark for severity is often the inability to breathe and get oxygen into the blood. So, but it's a great question, and heck yeah, I'd try it.
Dr. Capper, since we're talking about these things and upper respiratory infections, let's talk a little bit about at-risk populations. So the CDC actually lists diabetes, liver disease, severe obesity, heart and lung conditions as underlying conditions that can lead to extreme COVID-19 symptoms. So for those individuals who have these types of underlying conditions, how important is it for them to take preventative measures to avoid getting COVID-19?
It is absolutely important for anybody that has any of those conditions to do their best to limit exposure to almost anybody. This is a remarkable observation that these folks who have these other conditions really do poorly with this virus. So they should do everything in their power to try and limit their exposures to other people.
Also, I do want you to chime in on this just information that we've all heard in the national media from the Dr. Anthony Fauci, the director of the Health Institute. So he talked about COVID-19 actually shining a light on health disparities that exist among African Americans and other minorities when you talk about these underlying conditions.
Right.
Just from your perspective, Dr. Capper, what can we learn about improving our healthcare system in a situation like this where we can see African Americans and other minorities being disproportionately affected?
Well, it's a beautiful question because it brings to light opportunity that we have as a society. And with that opportunity is looking at why it is that certain populations do worse than others with the same illness. Blacks are not more prone to get COVID-19 than anybody else. It just so happens that as a percentage, Blacks who get COVID-19 actually do worse. And we've begun to understand this more in the last month of deep diving into those patients that are affected, and it's because of these other comorbid conditions. We know that people who live in certain neighborhoods, and I like to look at this as a neighborhood issue, people that live in certain neighborhoods tend to have certain behaviors that are different than the next neighborhood over, for example. You look at food consumption. What types of foods are being purchased at stores? What type of foods are being offered at stores? We know that in lower income neighborhoods, there's less available fresh fruits and vegetables for people to purchase. That's important because the net effect over the long term is looking at the incidence of obesity in certain neighborhoods. And so we know that obesity is a terrible predisposition to bad outcomes with COVID-19. And so the incidence of diabetes, the incidence of obesity, the incidence of hypertension, and ultimately also the incidence of heart disease is higher in some Black populations. And I think that's the primary reason. And it gives us an opportunity now to begin to address this, and let's address it on a neighborhood level.
Good information, Dr. Capper. Thank you for that. We have a question. We have a few questions that actually came in from our viewers. Thank you for submitting your questions. So this question is for Dr. Anderson, and it's from Mary. So the question is, if you have COVID-19 and you're monitoring your oxygen with a phone app, at what level should you possibly seek medical attention?
So Dr. Capper may want to chime in here also in just a minute, but I would say if you're dropping in the low 90s and you're not, if you're taking deep breaths and you're not able to get it up into the higher 90 in the percentages, then you want to monitor that. Certainly other things that you want to be looking for are bluishness around the mouth, cognitive issues, not being able to, having mental fogginess where people aren't communicating well with you, lethargy, that where they don't feel like they can do anything and they're not very responsive. Those are things that would be indicators that oxygen levels were dropping and that they were having difficulty, and you would want to call your medical provider.
Dr. Capper, anything to add to that?
Yes, and then I'm going to bounce it back to Dr. Anderson. Some people that are being discharged from hospital, for example, are being discharged without oxygen. Some people are being discharged with oxygen. And primarily a decision at the site of care, the emergency room typically, where people can go either way, but they're not sick enough to really require hospitalization. So they'll go home with some supplemental oxygen and with an oxygen saturation monitor. These are cheap, they're easy to use, and everybody can do it. And to Dr. Anderson's point, people should pay attention to that if they feel like they're getting sicker, if they're feeling particularly like they're having a more difficult time breathing. The second part of that, though, is having a contact person. This whole idea of telemedicine has really just exploded into the forefront with this pandemic. That's a good thing. But what good is it to have your end and not have the connection on the other end to somebody who can give you some advice? So make sure that when you're going home, you have somebody that you can actually have contact with to be able to answer these kind of questions when those things are coming up.
Dr. Capper, you actually brought up a good point that was a question from one of our viewers. You mentioned telemedicine just a second ago. So Ben wanted to know, will telemedicine be used more in the future due to the COVID-19 pandemic kind of putting it at the forefront of the best way to get care and not overload our healthcare system?
Of course, I can speculate, but the one thing that has happened with this COVID-19 and the shutdown of the medical system is the recognition that you can't shut down the medical system to routine care and low urgent care. You still have to provide care somehow. If you're trying to create that physical distance that we're all trying to create, what better way than through telemedicine? And it has really helped us to serve to fill that gap. I think the good news is this is a technology that is here to stay, that all of a sudden we can expand the opportunity to care for more people with less applied resources, less cost, and still provide care to more people. I think this is a great thing.
And Dr. Capper, you have a lot to do with what our medical students are learning and how our curriculum is set up. Our students have online since we all had to kind of start to work from home. So their transition has actually been pretty good. Online classes, they haven't actually missed it. But from your perspective, for medical students who might be watching this live chat, what kinds of things are they learning about the pandemic right now, since it's in the forefront, it's in the news, and they're actually learning in their first year medical students?
Well, one has to think about medicine in the context of its whole and the totality. Public health, team-based care. How much do other people on that team play a role in caring for people? What about epidemiology? All of these things really are real. This is something that now you could teach in a textbook and in a lecture fashion, and you can have these dialogues, but until you see it play out like we are today in real time, that is phenomenal learning for a medical student. The other thing is realizing that clinical medicine takes time and effort, and there's no way I'm going to be a good clinician on a telehealth without having the opportunity to learn clinical medicine in person with people. So the application of telehealth is great, but it still requires that that person is going to learn face-to-face with human beings and examining, taking histories, communicating with human beings. Because in a telehealth environment, you're relying on that kind of experience, and then you're relying on your ability to really communicate with people and extract information and communicate information.
Thank you, Dr. Capper. So that will actually do it for the Our Doctors versus the Internet live chat today. I want to thank Dr. Capper again, and also Dr. Anderson.
You're welcome. I just wanted to let viewers know too that if you go to cdc.gov/coronavirus, there are many answers to the questions that were presented today on caring for your loved one at home.
Good. cdc.gov. All right, so we appreciate everybody taking the time to join us for this important conversation about caring for patients at home with COVID-19 and also at-risk populations. Now, make sure you stick with us, because next Thursday, we're gonna have another live chat at 1 p.m., that's April 23rd, and next week's live chat is going to focus on nutrition and also mental health. So we'll have some recipes that you can share that parents and kids can use to get themselves throughout the day and throughout the week in a more manageable and healthy fashion. So that should be a really, really good conversation. So once again, thank you everybody for joining us and being a part of this live chat today. And we will see you next week.
Bye-bye.